Welcome to the Medical Rocket Channel. Today, we'll be learning how to distinguish Crohn disease from ulcerative colitis, a classic high-yield comparison in inflammatory bowel disease, IBD, that shows up frequently on the USMLE and clinical rounds. Overview. Both Crohn disease, CD, and ulcerative colitis, UC, are types of IBD, not to be confused with IBS, which is irritable bowel syndrome. They share some overlapping features like diarrhea, abdominal pain, and systemic symptoms, but differ significantly in their pathology, distribution, and complications. Location: Crohn disease can affect any part of the gastrointestinal tract from mouth to anus, with the terminal ileum being the most common site. Ulcerative colitis always begins at the rectum and spreads proximally in a continuous fashion. It is limited to the colon only. USMLE. Tip. Crohn skips, UC creeps. 2. Pattern of involvement. Crohn. Skip lesions, meaning areas of normal mucosa alternate with inflamed sections. Ulcerative colitis. Continuous inflammation with no skip areas. 3. Depth of inflammation. Crohn. Transmural. Involves the entire wall of the bowel. Ulcerative colitis. Limited to the mucosa and submucosa. Transmural inflammation explains why Crohn leads to complications like fistulas and strictures. 4. Gross appearance. Crohn. Cobblestone mucosa. Creeping fat strictures. Fistulas. Ulcerative colitis. Pseudopolyps. Loss of haustra, known as the lead pipe appearance on imaging, lead pipe colon, is a classic buzzword for UC on barium enema. 5. Histology. Crohn. Non-caseating granulomas. Th1-mediated immune response. Ulcerative colitis. Crypt abscesses. Th2-mediated immune response. Granulomas are a hallmark of Crohn disease but are not always present. 6. Symptoms. Crohn. Diarrhea, which may or may not be bloody. Right lower quadrant pain. Weight loss and fever. Ulcerative colitis. Bloody diarrhea. Left lower quadrant pain. Tenesmus, a feeling of incomplete defecation. 7. Complications. Crohn. Fistulas, strictures. Perianal disease, malabsorption. Ulcerative colitis, toxic megacolon, fulminant colitis. Increased risk of colorectal cancer. Toxic megacolon is a life-threatening emergency in UC. 8. Effect of smoking, Crohn. Smoking worsens the disease. Ulcerative colitis. Smoking is protective. This is a classic board exam trick question. Always remember, smoking helps UC but harms Crohn. 9. Extra-intestinal manifestations, shared by both diseases, arthritis and uveitis. Crohn also includes erythema nodosum, kidney stones. Ulcerative colitis also includes primary sclerosing cholangitis, pyoderma gangrenosum. 10. Serology. Crohn. Positive for ASCA, anti-Saccharomyces cerevisiae antibodies. Ulcerative colitis. Positive for PANC. 11. Surgical management. Crohn. Surgery is not curative. Disease often recurs. Ulcerative colitis. Colectomy can be curative. USMLE, high-yield pearls. Recap. Crohn. Anywhere in GI tract, transmural, skip lesions, granulomas, ASCA. Positive, complicated by fistulas and strictures. Ulcerative colitis. Colon-only, mucosal inflammation, continuous pattern, PANCA positive, associated with toxic megacolon and colorectal cancer. Granulomas are key to Crohn disease. Lead pipe colon strongly suggests UC. Smoking is protective in UC, but worsens Crohn. Thanks for watching. If you found this helpful, don't forget to like, share, and subscribe to Medical Rocket, your launchpad to a successful medical career. Stay focused, stay inspired, and keep pushing toward that white coat dream. See you in the next video.